Updating tonight's top stories, Singapore to have 4 COVID-19 vaccination centres up and running by the end of this month. Another 4 will be set up in February. The Health Ministry says more will be progressively added. At the same time, Singapore is to review vaccine data from Chinese drug firm Sinovac before any possible rollout. Researchers in Brazil are already reporting that Sinovac is only 50% effective. And for more, Professor Dale Fisher from the Yong Lin School of Medicine joins us for more on this discussion. Professor, the vaccination centres, are they adequate in terms of numbers of location to vaccinate the population?
Hi, Steve and Ortelli. Thanks for having me back. I think you should. It's also the minister mentioned that it'd be polyclinics and some GPs would also be part of the program. So I think it's more about the target to vaccinate all Singaporeans this year, and I do think it's very realistic. Singapore is very accessible. There's no real geographic challenges. We've got the technology to manage the cold chain and the data and all the various steps along the vaccination pathway. So I think we can be confident that we're on a very realistic pathway.
So, Professor, we know that more than 6,000 people have already been vaccinated. But in terms of hitting our target, vaccinating everyone by the end of 2021, you see us being on target for that?
So again, we're in a different situation in Singapore. We obviously have control of the pandemic within our borders. You really see countries like UK and US talking of targets because they've got that health emergency, if you like. So there's good reasons that Singapore's going forward with vaccination, but I'm not so obsessed by targets of how many today, how many this week. It's more about ramping up the situation and gradually opening up more centres, later the polyclinics and the GPs. It'll be incremental, but as I just said, I think the goal to vaccinate everyone this year is very realistic.
Yeah, you do seem very confident in Singapore's rollout. Researchers in Brazil, though, are saying that China's Sinovac vaccine's overall efficacy rate is much lower than earlier reported, around 50%. What does that imply, and should we be concerned?
Steve, I'm actually more concerned about this drip feeding of information. I think it's quite ridiculous. We've seen it going on for so long. Companies wanting to give out good information, phase 1 data, phase 2 data, but this different countries giving out different interpretations with no consolidation of the information, no verification. My view of all this is let's just wait for the phase 3 data to run its course, be published, and then let's have a look at it. I really don't care so much for all these interim, they're almost rumours sometimes. Maybe it is less effective. It's certainly made in a different way, but perhaps it's got a specific role in a subpopulation, for instance. So I'm really just waiting for publications in medically scrutinised journals, and then we have a thorough review of the data by authorising bodies around the world and WHO, and actually see what the role of these vaccines are.
Well, in the meantime, our Minister Lawrence Wong has urged Singaporeans to be vaccinated with an approved vaccine rather than, hold out and wait for another brand. What do you read into this message that he's trying to send?
Listen, I understand that people are a little bit nervous. They feel that it's been rushed out and there's plenty of opportunities for bad press, bad rumours, anti-vaccination campaigns. But really all the boxes for developing this vaccine have been checked. It's gone through the animal studies, the phase 1, the phase 2, the phase 3 studies and authorisation and scrutinisation of data. Normally when vaccines take longer, it's because there's a lot of pauses along the way while companies go for more funding and things like that. So I completely agree with what Minister Wong is saying. It's hard to imagine getting a lot better than than a vaccine with a very good safety profile, 95% efficacy, and there's really no rational reason not to vaccinate. And especially in Singapore, we're going to be conservative and not do it in the groups we haven't seen the data on yet. That's children, pregnant women. We're going to monitor people for 30 minutes afterwards to look out for allergic reactions. So really, if people want their old lives back and people want to travel, we're not going to get there without herd immunity. So I urge people to take the vaccine when your turn comes, and let's get on with this.
And just quickly, you'll be doing likewise, Professor?
I'm scheduled for 8:40 on Friday morning, Steve.
All right, well, all the best. Thank you very much for speaking with us this evening. Professor Dale Fisher from the Yong School of Medicine.